Hi everyone, I'm Marco Piccininni. I'm a postdoc at the Institute of Public Health and the Center for Stroke Research Berlin at the Charité Medical University in Berlin, Germany. Today I will present a project I worked on with my colleagues at the Charité that will be published in Epidemiology with the title The Effect of Mobile Stroke Unit Care on Functional Outcomes, an application of the front door formula. We used data from the BPROUD study, which was a study conducted in Berlin between 2017 and 2019 to assess the effect of additional dispatch of MSU. MSU is Mobile Stroke Unit and is a special type of ambulance that was designed for the care of stroke patients. In our study, we wanted to answer a different question, which was estimating the causal effect of additional MSU care rather than the dispatch on the 3-month functional outcomes among Berlin stroke patients. We focused on patients for whom an MSU was indeed dispatched and who did not have contraindications to reperfusion treatments. Answer this question wasn't trivial because there was a lot of unmeasured confounding between the exposure and the outcome. Indeed, when an MSU is dispatched together with a conventional ambulance. And most of the times the conventional ambulance arrives at the scene before the MSU, and the personnel can make the decision to wait or not to wait. Like they can just decide to take the patients and bring them to the hospital without waiting the MSU. So there is a lot of determinants of the exposure that are unmeasured. Therefore, to try to tackle this problem, we relied on the front door formula, a formula to identify a causal effect in the scenario in which you have a measured confounding of the exposure-outcome relationship, but you have measurement of a full mediator, which is a variable that fully mediates the effect of the exposure on the outcome. This formula was developed by Pearl in 1993. So to answer our causal question, we draw our DAG, we operationalize the variables, and we used the parametric estimator developed by Fulker et al. Using ordinal logistic regressions to model the conditional probabilities. We conducted a few sensitivity analyses, so we used different approaches and we defined some variables differently. In general, it was very interesting to see in the results that the unadjusted association was in the direction of favoring the conventional care ambulance compared to the MSU ambulance. This is because the personnel decided not to wait for the MSU when the patients had less complex clinical presentations. Indeed, we can see quite some difference between the groups in terms of prognostic factors. After applying the front door formula and after estimating the effect, we found an association between MSU care and 3-month functional outcomes, which was in the opposite direction. So there was an opposite sign, suggesting indeed that receiving MSU care resulted in a more favorable outcome compared with receiving only the conventional ambulance. And this aligns well with the results from other large observational studies and with the recommendations from the European Stroke Organization's guidelines. There are several limitations you should consider when interpreting our study. We made several assumptions in the process, and we tried to report them as transparently as possible. For example, we assumed that indeed Z was a full mediator. We assumed that there was no unmeasured confounding of the exposure mediator and mediator outcome relationships. We also made some assumptions about the functional relationship, the operationalizations of the variables, and the role some variables had in the causal process. Hopefully now I convinced you to take a look at our paper, which is one of the first applications of the front door formula in the health domain. I really believe this approach has some unexplored potential in medical and public health research. I hope you'll find our work interesting, and thank you for listening.